Caladenia was in a unique position to respond really, really quickly to the changes to our service from the pandemic. We're a small organisation. Our staff are very dedicated to what they're doing. So they responded really quickly with the client's best interests in the centre of their mind and thought about what they could do to actually assist those people through this time. My workplace health and safety officer, who I finally delegated all that sort of work to about 12 months ago, suddenly found herself working full time for that 2 weeks, putting in new infection control and sanitising, and then we cancelled our outing programs, and finally we cancelled our programs. Our staff are incredibly creative and they started making activity packs to send home. That helped us build a program of things that will now see us through this period until we can run our social support programs again. The staff here sprang into action when we had to cancel our face-to-face services. We started phoning each and every client and their carers and just doing a really quick new care plan about what they needed to see them through this, how they were going to cope with the isolation, did they have good family backup. So from there we identified some people who were going to be at risk, and those people we're contacting a lot more regularly than those who said they've got good family backup, good support. One of the benefits, I think, of being a standalone organisation and a small organisation is that we can respond very instantly and very organically. I can just phone my staff and say, hey, I've checked with everyone else. I think it's going to be all right. We're going to do it this way. That stood us in really good stead. It's meant we could be very creative. We've got incredible staff who really believe in what we do and who have a genuine regard and responsibility towards the people that we care for. And so they were immediately thinking, I think, on an individual basis, what can I do for that person? And talking to each other about, let's put together this, let's do that, let's drop off these books. So we were kind of working on two levels, I think, at the beginning. The staff made themselves busy and made themselves useful while I sat down and actually had some strategic thinking time after the giant panic, and we planned how we were going to go forward. COVID-19 has obviously changed the way we're delivering services at the moment, and I think it will change the way we deliver them in the future. We've had to really push ourselves and push our comfort zones to jump into some new technologies, and I would love for us to take those technologies further, given time, proper time to plan and use them in people's homes. Some of my staff are already talking about remote programs for those who perhaps can't get here, people who live further out in the Shire, people who don't drive. Could we have a carer support group like a Zoom session? Could we do some webinars where one of my staff's doing chair-based exercises and everyone's following along? Will we make a whole lot of resources and put them on YouTube and advertise our YouTube channel to people who are isolated at home? We've got now a beautifully written pandemic plan, if anybody would like a copy. It's incredibly comprehensive. I think in general too, it may change the way we work with our staff. Do they have to come in here to do their planning? Can people be more flexible and work from home for some tasks? I think one of the things that really stands out is Bronwyn's Zoom session last week. For my team leader, Bronwyn, to gather those people together, email out the instructions, make sure that the family members knew what time and how to get into the link, I think was a huge accomplishment. The feedback she got from that was absolutely fantastic. We had emails straight afterwards from the carers saying, thank you so much. It was so nice to see people's faces. It's one thing, I think, to hear people on the phone, but to actually see their faces made a huge difference to those people living with dementia.